Hello and welcome. This is Rethinking Rural Health Financing on What About Rural Health? You are listening to the podcast that asks the question too many people forget. What about rural health? I am your host, Chinasa Imo. Together, we are uncovering the stories, challenges, and innovations shaping healthcare in overlooked communities. In this series, we ask hard questions about how money moves, who gets funding, who gets saved, who gets served, and who gets excluded. From policy to practice, we explore what healthcare financing should look like for everyone. Today, we'll be discussing reconnecting to the source, community psychology, and the future of rural health. Amina lives in a rural community where the nearest health facility is 2 hours away. Her teenage son, Ali, started withdrawing, missing school, and waking up at night with panic attacks. There's no counselor to call, no mental health line to dial, no social worker stationed nearby. The local clinic is understaffed, underfunded, and focused almost entirely on handling cases such as malaria, childbirth, and emergencies. Mental health or psychosocial support in this community is considered a luxury. What does Amina do? She does what community members have always done. As mainstream health systems continue to fail them, she turns to neighbors, the women's group at church, a respected elder in the community, a teacher who notices something is wrong with her son. Informally, she receives care, not through formal health financing structure, but through the people in her community. Now, here is the uncomfortable question. Why is it that in so many rural and underserved communities, especially those in the global south, healthcare systems may collapse, but communities themselves do not? If so, then, why are we not treating community as a framework? At a time when the global health funding is shrinking, governments are struggling or even unwilling to adequately fund health system, and rural communities are the ones who constantly struggle. Community psychology may offer a powerful lens to understanding preventive care, collective well-being, local knowledge, and shared responsibility for health. So, today we will be asking the question, can community psychology help us reimagine rural health equity when the system, as it stands, is simply not enough? This is where my guest, a renowned community psychologist, comes in. But before we dive in, let's take a quick break. If you are enjoying this conversation, don't forget to subscribe to What About Rural Health on all streaming platforms. We are on Spotify, Amazon Music, Google Podcasts, Apple Podcasts, Listen Now, and so on. And yes, we are on YouTube too. Your support means a lot to us. So please like, leave a comment, share, and most importantly, drop us a review. It helps others discover this important conversation. All right, back to the episode. You are still listening to What About Rural Health with Chinasa Imo. Without much ado, let me introduce you to my guest. Joining me today in the studio is Dr. Moshood Olanrewaju. He is a community psychologist and professor at Adler University here in Chicago. He was recently elected president of the Society for Community Research and Action. His work sits at the intersection of community well-being, human rights, and systems change, with a strong focus on migrants, displaced communities and populations, and other marginalized people. Moshood brings deep experience in research, policy analysis, administrative advocacy, and grassroots organizing. He is especially committed to community-led solutions that challenge traditional models of refugee resettlement and social support. His scholarship and practice are grounded in critical and decolonial approaches, drawing from African knowledge such as Ifa and Ubuntu to reimagine what solidarity, care, and healing looks like in real communities and to help shape the future of community psychology globally. Beyond academia, Moshood has spent years thinking about how communities survive and adapt, especially in contexts where resources are scarce and systems have failed. This had led him to translate theories into practice, working alongside communities to address social and health inequalities in ways that are locally responsive and ethically accountable. I am excited to have him here in the studio with me to have this conversation, especially the fact that this year, the International Conference on Community Psychology, ICCP 2026, is heading to Lagos, Nigeria, where Moshood is the lead convener. So, Dr. Moshood, welcome to What About Rural Health?
Thank you. Thank you, Shinasa. Can you hear me?
Yes.
That was too much. All of the background story.
It is your accolade now.
Begging. All of that is doesn't solve the problem that we need to solve. But we need to build those profiles to do the work we need to do. At least it opens the door.
I agree.
So yes, thank you.
I absolutely agree with you. And I think that also it gives you the authority when people listen, when they hear all the things that you have done. It's not every day that we see people who commit to community development work in ways where they are merging policy, research, and the actual work on ground together. So that's really nice of you. And thanks for joining us. So let's dive deep into the conversation before we start throwing this policy conversation frameworks here and there. Let us ease in the conversation by first drawing you to tell us what made you pursue community psychology as it is. And at one point, did you realize that this is a career that is public facing and impacts real life people within where they reside?
Thank you. That's when you were reading the intro, you referenced community as a framework. Whether we are doing it or not, you said we should go back. You said it would be a good thing to kind of investigate. So I can say my draw to community psychology came from a place of discomfort, right? What that means is, even before I say what psychologists do, the idea is that I think there's a lack of curiosity for psychologists.
Yeah.
Um, Curiosity for things like racism, poverty, displacement, violence, shame. I don't think psychologists invest that as much as I think they need to invest. So in the area of time, because I was born into a particular community, the same way you think you were born in Nigeria, all of our life, it was about community. It wasn't just you and your mother, you and your father. It was more of the community, and community will raise you, right?
Yeah.
I see that growing up with my grandmother. So when we came here, when it becomes some sort of selective process, and my work, around immigrant at that time was also showing up in that. You will see migrants come here and they are confused. Where do they place themselves? Do they take on their host identity? Do they have to leave the one they have behind? People were confused. And I can see this on a daily basis while I interact and I used to do what you call breaking bread with migrants then. So when they come into the environment, outside of interacting with organizations, I will meet with them on just like you and I are sitting now and talk to them, but realize that the thing they were telling me was creating discomfort for my life. Simply because to access the system, they need to behave in a certain way. They need to be a certain way. So that discomfort was what led me to searching for like a PhD program. That same discomfort is what led me find community psychology, because the definition, the theory, the concept that we use, the framework, seems like, okay, this is what we grow up with. This is what we do, My grandmother would send me to the next house. Or my grandfather would send me as young as grandfather would send me from let me give a good example. So we're on this west side now, right?
Yeah.
My grandfather would send me to the deep south side. That's a couple of miles away to go and buy what we call akara, bean cake. As early as what? Maybe when I was 7. I didn't know they were training me then because they trust the community to hold me while I'm traveling back and forth. You can't do that here anymore. We don't even do anyway. We don't do evidence. We don't trust each other. So those discomfort was what set the pace in the beginning. Like, how can I bring this into, once I see the theories, the concept of concept, this was what drew me to, this would be a good way to kind of not just beyond the theory that I'm reading, but it seems like this is action-oriented practice. And that's what we call it. We do it as we're creating the theories, we're actually orienting it to practice in the community. And you can see some of them are actively working at the same time. So yeah, it was the discomfort that brought me to community psychology. But when I discovered it, it became very familiar as something we grew up with. So that was where the work started.
Thank you so much for that description. And when you were mentioning, I remember myself, growing up in my own local community. We used to have like, I don't know. I don't know if people can still relate this is this happening. I mean, this is not a long time ago, but we used to have like all these moonlight dance time, folklores and folk tales where, during in the evening time we will all come out and the elders will tell us stories and kids will stay outside and play. People fight. There's even, we call it mba. They will do competition about fighting where young men fight each other to figure out who is stronger than the other. And those things kind of like dovetail to even how they grade leadership. Those that are stronger get to begin to ascend to family leadership and all whatnot. And also get to be the people that communities go to for certain levels of protection. Like if someone is bullying your sister, you go call the person in the family that is the strongest to go and teach the next person, And to me, those things were social cohesion that when I'm now walking into the new life of the new young people now, those things are not available. Everybody is on their phones with their headphones in their little corner on social media, and I'm wondering where did the social life that I enjoy go. So thank you so much for bringing all of this to bear. But I know that a lot of our listeners will be wondering, what do we mean by community psychology? And some of them are hearing this for the first time. So, would you explain or try at least to describe this so that we'll all be in the same level as we move on in this conversation?
I would do that. But I wanted to remind you that what you just described is why we wrote Tales by Moonlight as one of the themes in the conference, in the SCV conference, because the section is going to be outside in the open. So people can enjoy in that you're talking about. Because again, truly, this communal sensibility is where we pick leadership. Is where we know who's going to be what, how they're going to do it. It's a communal senses, and we've definitely lost that. Nothing is wrong with what we have now because the world is AI technology generated now. But if we neglect those history, and that's what the definition of community psychology is. Going back to the question you asked me. The definition is with CP, with community psychology, there's access to power, access to systems, right? There's history, there's places, there's liberation. They're all rolled together and we understand them, right? If somebody was to ask me what it means, if I know the history of a place and the people they're in, right? If I need to design intervention for them, of course I know the persons to go to because I know the history of the place. If institution is not working in a particular place, we know who to go to. If we design an intervention and realize it's lacking something, why is it lacking something? Is it because if you look at the history that we have before, is it because certain things will not work? And I tend to take this in a whole different space that, there's something as part of our study. You ask for definition of conservation. It's very broad. It's not easy to just say. Without me going too much, the word is people are dying across the world now in numbers. There's nowhere there's no war right now. Now, that's against what we conceptualize nature to be, right? in terms of mass barrier. For instance, now, the heart, the mother heart itself, is crying that this is not the proportion of what I want, because there's revitalization is process, right?
Yeah.
When we bury amount of people, we recycle all of that. But imagine how many people will bury so much that in places like Gaza, for instance, right now, there's no more burial ground. In fact, there's no more burial ground for mass burial. And so this is asking, or there are epistemology that we've used to study to realize that this health, people think because it doesn't speak. I mean, people that don't understand it think it's not speaking. It's asking us, like, what are you guys doing?
Yeah.
When people die where we come from, this is very essence of psychology. We process it's a ritual process. Whether you're Christian, whether they are Muslim, we honor their going. Whether they are young, we honor their going. And this would be elementary community psychology definition. They die, it's a natural process. Whether accident, whatever, we honor the process, put them to health. Whether we do cremation that some people do, whether we bury them, But in the case of where we are now, where we have mass burial, so much that there's no even more space now. What nature and health is not asking us is, this is not the negotiation that we have before. So there's misalignment. Now, if I was to define what we are doing, is to be in the place where we can speak to motherhood, like, okay, this is why mass burial is happening. Do we need to do some kind of sacrifice? And you know that this is what we used to do to honor both the living and the dead. Because
Yeah.
in myth, there's halfway that we meet, right?
Yeah.
That's an extreme example of how I would say we interact with what you see on a daily basis and what you don't see. Some of the things that the theoretical framework cannot conceptualize. This is what community psychology is running after. Like what I was just describing. Because we have the language that the health world speaks.
Yeah.
We're the same. Unfortunately, we've kind of separated ourselves from that. That's on the extreme. Homelessness, for instance, it's because by definition for community psychology, you already know homelessness is not a thing. It's not part of our DNA. It's not like it's something that we're all born with. It's man-made. So therefore, it's easy to just kind of design system to get rid of it. But how do you design system to get rid of it? Where do you start? Is it the government system? Is it the human people themselves? There's all blame to go around. At the same time, there's always figure out processes to deal with it. So it is too broad because because of where I'm from, would design community psychology as a understanding of the system, of the history, of the places, of the people. Some other person, depending on what they're doing. For instance, someone like our dear friend, our dear colleagues, Loretta, doing what do we call what Loretta is doing now?
The thing on opioid reduction kind of intervention with the public health.
That intervention, she would design community psychology differently.
Yes.
And Dr. Titi who also designed it differently because Titi is looking at both
intimate
right and all of that kind of stuff.
Yeah.
But we're all community psychologists. The difference is because of the complexity, it's easy for us. I could be an engineer tomorrow with community psychology because of the trainees, because of the content. We have to practice with about 25 different competencies.
Wow.
All you have to be very educated in each of them. So it's not easy to just divine one, but the elementary is you have to know there's history behind power, behind system, behind places, behind people. Once you can define each of these, there's a better way to say this is how I am defining my own community psychology.
I wanted to ask you to add a rider. You've described like a whole lot of processes of what needs to be done to understand community. So typically when a community psychologist go into a community, what is that thing that they are looking for in order for them to provide all of this historical background that you have just mentioned?
It used to be the mainstream psychology will always say defect. And we some of us still look for defect, but it's not defect anymore. Defect is actually part of the process.
Okay.
Things cannot be right every time. That's primary elementary prevention system that we understand. Like, of course, if I'm okay every day, something is not right.
That's true.
So at some point I have to be sick, right?
Yeah.
So we already know the defect is part of the process. So, but who are the holders, the stakeholders of that? Who are managing the processes? So if someone is sick in the community, if someone is being affected by X, Y, and Z, who do you go to see? So we're talking about the traditional, system, right? They're always the first, they're the gatekeepers. We're talking about the faith-based leaders, right?
Yeah.
We're talking about the kids in the community. They see things differently. The built environment.
Yeah.
All of these, we have to analyze them. So we're not looking for one particular thing, right? If a system is already built and it's not functioning, there's a reason why it's not functioning. What do we need to look at? Why is it not functioning? Who owns the key? So before, and I'm sure as a public health person, almost every time what we're looking for is default.
Yeah. I mean,
Is that a lie?
yeah.
Oh, what we're looking for is default. Oh, there's not enough money. And all the money in the world would not solve the problem if we did not do like a direct analysis of dancing with some of the people that I've just listed now. They have the access to what you're looking for. The people, the solution to a lot of the problem lies within the people, the same people that we're actually trying to go and work with. But we often go there as, well, not often, but people go there as we know what we know. So we're going to go and help them and tell them what they need to hear. Archaeologists, I think, actually did a lot of number on the world. Archaeologists. Because they go to this environment and they write whatever they write. And then some of us are living with that. But almost all the time you realize that it wasn't a participatory process with the people. It was Lord over process, right? What we have now, what we are using now is with participatory policy and processes and intervention. I'm not doing the work. The people are doing the work for themselves. I'm just there as like a caregiver, caretaker. If they need X, I can get it for them. At least that, in fact, as a leader in community psychology, majority of my work for the past few years is about promotion, which is why we're also going to do this conference in Nigeria. Many of us are community psychologists, right? But we're not going back home. We're doing it outside. And you've been public health forward person. You're also a community psychologist. Because community psychology is not so much of one discipline, right? We have the non-traditional community psychologist, which is what I would consider you as. You're not trained in community psychology, you're a public health person. But because of the work you do that is in community.
Thank God I've been adopted into the community psychology hood. Can you believe this?
The pastors, the babalawo that has not gone to school in a day, they hold more education that can salvage and solve the problem that we are trying to analyze in the community. The rich history of what they have, we can learn it in theoretical work. So us learning the theory, meeting with them doing the what is it called? The practical aspect of it is the convergence is the beauty of what we're talking about, the work that we're doing.
Thank you so much for your response. And I'll just pick a little bit of what you have said and then merge them together to the next question I'm asking. And please do not shoot me. I'm coming to talk about money. I'm a policy person. You already declared that in the conversation that I'm a policy person because I'm looking at the fact that when there is no money, we can find all processes. We can put together different proposals, but in the world, in the capitalist world that money rules right now, to a policy person like me, the money conversation, the dollar conversation is very central. And I hear you when you say, and I validate that fact that money is not the beginning of root cause analysis. You have to do your root cause analysis first. You have to figure out what exactly is the issue that we are dealing here. Who have the capacity to do it? And oftentimes, I agree with you because I'm a follower of ABCD, where we work with communities to tease out those strengths that they have, those assets that are already within them, sometimes that the communities themselves overlook. Not that they don't know they have it, but they overlook the import of those assets and never use them in the ways that helps them address the issues that they're facing. And then the ABCD method coming in and saying, okay, you do have A, B, C, D, and Z, right? Can we repurpose them towards this way and see if that can help you solve some of the issues that you are grappling with? So I agree with all of that. But then to solve that problem also has to do with money. And that is where my next question is coming in. Like, I am trying to portray rural health importance, but from the lens of rural to global and global back to rural. Because those things, they are two-way traffic. They follow each other, right?
Yeah.
But then we can see, like, there's all this conversation in Davos that it just ended a few days ago. There's been ongoing conversation about what it means to do global health, right? And there's this continuous issues around health and funding advocacy. But the reality is that people are fatigued, funders are fatigued, governments, are struggling. And even when they are not struggling, for those who have certain amount of money, they are choosing not to prioritize certain health concerns. And to me, that is very central. So when we look at this and the failing system that is not funding psychosocial care properly, how do then community psychologists come in to help communities organize themselves or at least work to resist certain impositions of government within those communities?
Let me give you a very sort of experiential example, but then maybe we can test out from that. While I was doing my PhD, um, I stumbled upon a video in Nigeria of young people selling sachet water. We call it pure water, gala, all of that on the street. But the video created cause for my curiosity by saying, oh, the amount of kids dying from doing this, it's ridiculous. Like, we don't even have statistics to describe it. Because not only do they die immediately, some of them, the car will eat them and then they limp for the rest of their life. Some of them will take stuff that they should be on dialysis forever, but nobody cares because we don't have that infrastructure. We do have it, but it's not for everybody. They say that in the context of Nigeria. And I think I saw that in Ghana, I saw that in South Africa too. Now, I was doing my PhD then. My first instinct was I was going to go and do my research but I didn't go. I did it here. It was because it was refugee. What came from that was I did establish a non-repayable loan because after I went to do we'll do the first analysis of what is causing this problem. So I went to my own specific community, which is Badagry. And when I got there, I asked certain women. There's records, so people need verification for what I'm talking about. So I went to this community in Badagry and I asked somebody to lead me around. Why are you not? Some of the kids, the interview did ask them, and I can share the link to this, so in case you want to pull it into this later. The interview did ask some of these kids, like, why are you doing this? Say, oh, I have to support my mother, or I have to do this. Do you go to school? They say yes. Well, some said no. Then the girl pressed to ask them, like, what do you want to be when you grow? Some of them say, I want to be a lawyer, I want to be a doctor, I want to be every fine entrepreneurial skills that you can think of, they listed, or professional skill rather, they listed. Now, that got me curious. Like I said, psychologists like that curiosity in the first place, which is why we have what we have with poverty. So I went to Nigeria. After all of the analysis, we did what we called no repayable loan, and we gave this non-repayable loan to the women. Guess why we gave it to the women? You will know already because of...
Yeah, because the obvious one is the kids say they're doing it for their mothers. So if you give the women the money, yeah.
We gave them simply because the money we were giving was very small. It was my money. It was about 3-4 million of my money. My wife would kill me if she heard that I spent all of that. She knew I took some money, but eventually didn't know how much the total was. So what we did was I took this and I met with some team in Nigeria. We were giving, the max we were giving was $500,000 and 500,000 rather, all the way to 200, 150,000 was non-repayable. So, but every week they have to kind of put something back in that account that's feeding them. This went on for 4 years. Anyway, the reason why we gave the women was because with women, even if they're selling sachet water, they're so entrepreneurial, they will make something of it. The only time we gave men was because if he already has a business and the business is struggling, is when we support them with that non-refundable loan. Anyway, majority of the people we gave money was 70% women. And for 4 years, they were doing this consecutively. So much that every time I go back now, after this, I'm talking about like 10 years ago, I will still go and sit with some of these women, drink water with them, joke with them, like, you turned my life around. Do you know why it worked? Because some of their kids now graduate from school. Do you know why that worked? The pressure of non-repayable loan.
Yeah.
Right.
Mm-hmm.
How much are we going to put in the system that is not going to function? Now, harvesting the system, understanding the system is what our problem is. It's not the money is the problem. Otherwise, all the money in the world that we already have, the money we've thrown into some of these things should have solved the problem.
That's true.
Because almost all the time, there's the selfish part that our people, not our people, the world. There's greediness everywhere. I just came across the idea that, because I'm sitting in a lot of powerful places, I just came across the idea that somebody will leave office. He's not making money. It's a non-profit. He's not making money. But when he leaves office, he will establish ABCD consultation so that he will now use that space to now get money from that organization. And it's going to be making mad money. We manage money the way we want to manage money. We're not using it for the right thing. We're not designing these things the way it's going to be very, very beneficial. This non-profit, this non-repayable rather, went for 5 years. No glitch. I don't know how it died out. I don't know whether we got all the money back. I know for sure we didn't get all my 4,000 back, 4 million back, 4 million naira back. But I know that it supports so many people till tomorrow that if I go to Badagry, I can still point to a lot of people that this is what changed their story. The pressure of non-refundable. And who is going to give that kind of money now? Even though there's billions across the world, who is going to look at that women that is in the very rural of the rural community and say this person is of deserving to give them? So why you're worried about money? Because we all been taught like that, like when we put X amount of money, it's going to solve the problem. It doesn't solve it because the woman is not by herself. There's a lot of alignment that needs to be, there's a lot of things that needs to be addressed before she can reach alignment with the system that you are trying to create for her. But oftentimes we don't address that.
Thank you so much, Moshood, for joining us in the studio today and for all of your thoughtful conversation and leadership as you continue to steer this conference. I am grateful for your time, your insights, and your commitment to communities around the world. And to everyone listening, thank you for joining us today at What About Rural Health. If this episode moved you, challenged you, or made you think a little differently, please follow, subscribe, and leave us a review on your favorite podcast platform. And as always, let us keep asking the question, what about rural health? Until next time, I am still your host, Chinasa Imo. Bye for now.